They're over there behind.
Right. It's 5:30. Let's get started. Special meeting of the Ector County Hospital Board of Directors is open to accept comments from the public regarding the proposed 2020 loan tax rate. For those wishing to make public comments who have not already done so, please sign in with Ms. Conley. Comments to the board will be limited to 3 minutes. Council will give the speaker 1 minute warning prior to the expiration of the 3-minute time limit. We also will be taking comments online if they're there and we know of them. We'll make every attempt to make sure of that. Before we start any of that, I'd like to ask Brother Tiffin to open us in prayer.
Let us pray. Lord above, we thank you for today. We thank you for the freedom that we have in the United States of America, that we have the freedom to gather, freedom to our voice be heard, the ability to live in a country, take care of us. We ask for your guidance and direction tonight. Wisdom. Ask for protection for us. Doctors and nurses and housekeepers, lab techs, all Lord, for our patients, families. Please bless medical services.
Amen. Very much, and thank everybody for coming. Not a pleasurable thing we do, but something that's very essential for what we have to do. So we will accept comments from the public at this time. Right now, I only have Ms. Lois. Okay.
First one on is beneficial. I believe in several buildings. Nurses taking care of the COD when not have internet. Nurse to make us quick. There is always bad day, bad hair day. It happens. All right, next problem is we're dealing. Have a lot of people, justices. And the thing is that you guys take. That's what you have to take into consideration. Raising taxes. They're all. And it was founded on a belief. The people means you what is right for the people. What is right for yourself last. There's three good examples here. Rich and the green with argument. Two. Gourmet, belly. Three. Figures. 5 is to satisfy the and deliver that service. As it says in the Bible, our support. I thank you.
Thank you.
We have, or nothing else online? Is there anybody? Know of anybody online that wanted to make a comment? If there's anybody there, make yourself known. Can we unmute all? So to unmute, you do *6, and we will take any comments from anybody that can.
Not here.
You know what? I think. If there was no way. Yeah. Mr. Allen.
Don? Yes, sir. I think it's, good either for you or, myself, Ben, David, or any of the, on here to, and I know that we've been out in the public a little bit and maybe on the newspaper, but, you know, our shortfalls are not all done from bad leadership or, you know, bad, timing, well, maybe bad timing, not something that we're not buying stuff, we're not going on trips, we're not, you know, nobody wants taxes. I mean, you know, I've been unemployed for almost a year now, you know, and I feel the burden of what's going on right now. And I'm not the only one. I'm pretty sure that a lot of us, but this is the only place that you can come and get services that are licensed. It's not, you know, the money's not going to go for us to go to Hawaii. The money's not going to go for us to build another wing. Money goes to those who can't afford to take care of themselves. You know, those that have insurance, they're doing fine right now. They pay, and then we. So what I was just trying to say is that, believe me, taxes are not something any of us like, and I've had calls, and believe me, for me to tell you, it's not something that we do as a, wow, we're going to get from the poor to, you know, to make a better place for us to go party or whatever. It's not it. It's for those who can't afford to pay for medical services. It's for the surgeons and you know, radiologists and nurses and everybody that we can try to keep on and pay, because we're not getting any money out of the community, you know, for the services that we're providing. And that's what a county hospital is. You know, I just hope that this is going to turn around, you know, and when it does turn around, we're going to have good businesses that are making hands over fists. My goal on this board was to provide a better service for the community, and I think my goal going forward is to reach out even further out and make it to where when our community is making good money, that it invests in the hospital and not, you know, because it kind of, everybody forgets about the hospital whenever they're doing good. You know, they forget that we pay for the county jail, you know, treatment. They forget that we have places like on Clemens. They forget that we have great staff that reach out to people who can't afford care and let them into the hospital to get treatment whenever things are going great, you know. But whenever it's time for everybody to sacrifice, and it hurts their pockets, it's difficult. And, you know, I think that's something that, you know, we're going to visit at this time and address. But I do believe that whenever we pick up and we're doing a whole lot better and we have, you know, 1% unemployment, that subject comes back up again, that people pay something into the system or figure out a way where we can put a little bit into the tree instead of continuing the free, and nobody takes responsibility for, their health or for, getting insurance and stuff like that, because I know plenty of us.
Richard, I can move forward. Officer, could you look outside, please, and make sure that there's not anyone else there needing in, please? Make sure that there's not anyone in the building that needs to speak. No one online that we know that needs to speak at this time.
Mr. Chair, one brief comment.
Yes, sir.
Richard, Mr. Herrera, thank you for those comments. Let me tell you that, and our two visitors, that the first order of business when we rolled in to 2020 was, number one, to be as transparent as possible with our finances. Number two was to make sure that we knew that every dollar was accounted for. And that, I think if nothing else, that has been accomplished. We sat here last week and listened to Steve probably give the most transparent budget you've probably ever heard. And that we know where every dollar goes and where every dime is spent. And Steve, we appreciate that transparency from you. And I know we have two more, so I'll turn it back over.
Are either of you wanting to speak to the board?
I've never been to one of these. I'd like to see how it works.
Okay, well, right now, we're in the part of accepting public comments. If you wanted to make a public comment on the proposed tax rate, then now is that time. If you would like to do that, then Ms. McConley is going to need to get some information from you before you do.
No, I just want to finish really quick is, it's really easy to judge from afar, but I would love for anybody who has a question about this, whether online, is to come up, you can give me a call. Y'all have my number, or y'all can get it through the secretary here at MCH, and look at how much money comes out of MCH's pockets every month to cover the county, to cover indigent care, and you would be just lost for words of how much free stuff comes out of this county, or how much of the county hospital puts back into the community every month. And I'm sorry I sound so passionate. It just, after being on this board for 13 years, it hurts sometimes whenever we have to do these tax raises and people don't understand why or how it works. Thank you, Don.
You bet. Anyone else who wanted to speak at this time? One? If you're ready to speak, ma'am, come on up and we'll hear from you now.
Well, I don't even know how this works. Do I have to wear my mask here?
No, you don't have to right there.
You're
You
6
can
foot
breathe
away.
while you
You're
talk.
6 foot. I want you to talk through that mask.
You've got 3 minutes. Our attorney will give you a clue when you've got a minute left.
Okay, I don't know how this works, but I am concerned about the raise of the taxes. Like anyone else, and I don't know if anyone else has addressed this, but the economy's bad, the oil field's not up. My taxes still go up on my property taxes because the value still goes up with the every year, and I got the little yellow slip that says it does, so my property value still went up $35,000 this time. So just on my house alone, my taxes anyway. People have gotten stimulus checks, they're on welfare. People can't afford it. Everyone's suffering, we're all in this together, but I just don't feel like we should have to afford it. There's other means to get it, there's other things to do, work harder, work like everyone else, make some cuts, save some money. There's all kinds of ways to save money besides making the people suffering from this pandemic. And I just don't think that's what I have to say.
We get your name, please.
My name's Lisa here.
That's it. I appreciate it.
Thank you.
for coming.
Very good.
Mr. Chair, I'd like to make a comment.
Yes, sir, Mr. Quiros.
Now, and I share the sentiment completely. I know that we're all in this pandemic, and I'm a business owner too, and businesses are are down across the board, including in healthcare in this hospital. What we do as a community, though, is really, really important, I think, right now. The hospital has taken some tremendous financial hits over the course of the last 6 months through this whole thing. It hasn't just been the independent businesses, but our community healthcare system is suffering tremendously as well. And so what the way that I look at the thing, I don't want to pay taxes. I own a lot of property, and properties are all increasing as well, and that doesn't feel good for any of us. We're all in the same boat. We're citizens as well. But the hospital and public health is our duty and our responsibility to make sure that people like ourselves and everybody that's coming through this region have access to quality healthcare. And if there's an accident or something where life-saving procedure is required, we want to make sure that we have that resource available to us. We're all out here by ourselves, you know. We can't really go to Lubbock for every car wreck or for every surgery. So I feel passionate about what it is that you're saying, and I also feel very passionate about what the hospital provides to the community and the region. You know, and I want there to be quality healthcare if I am ever on the other side of that. You know, I'm in one of those rooms down there. So I just really appreciate your concern, and we do take those things into consideration. I appreciate it.
The only thing I'd say back to you is that, and to everyone, is that our management has made every cut. Everybody in this organization took a cut. We furloughed folks, temporary and for good. It's lean and mean here. We were asked to not do elective surgeries so that we could have the ability to take on COVID patients that weren't here.
We were told.
Yeah, we were told. And to the tune of $40 million. In the overall outlook for how much I'm going to pay for taxes this year, it's going to be overall sales tax and ad valorem less than I paid last year to the hospital or to any of Ector County. And we still have to meet the needs of the health environment for the county and the 17 counties that we support. I mean, I have to pay that too. We all are going to have to pay that. And believe me, I understand. There hasn't been a stone left unturned that I've seen. Every way that we could cut, I've seen cut. And I think they've done an exemplary job. And I've said it way too much lately to you guys. How amazing this team is. So we're going to go forward. Thank you all for coming. Thank you for your comments. It's not taken lightly. It's taken with great understanding. We're all in this. So we'll go on to the next item. We're going to consider approval of agreement for development of observation unit. Kristen Timmons.
Thank you. This evening, as you know, we're obviously increasing with our challenges of capacity and demand and throughput. We had come a month ago regarding the emergency room so that we can see more patients and quickly. Because when we work efficiently, it obviously impacts our bottom line as well. So through all of this project with the emergency room, we came across envisioning an observation unit. And so we looked through a lot of our data, and as we continue to look at those lower reimbursements that are affecting our financials, we started looking at our observations. So medical center has 30% of observation cases that are discharged in an observation status, which really the industry standard is about 21%. So we're discharging people not inappropriately, but in the wrong status, which affects our reimbursement. And 31.2% of our outpatient, or about 2,000 cases, they actually stay greater than 48 hours. So we're not converting them to an inpatient status either, which ultimately affects our reimbursement as well. So I visited with Mr. Ewing about the creation of an observation unit to work on decreasing our length of stay, bringing up our bed conversions, working with our utilization management department to really convert the people that need to be converted, get clinicals on those people to validate why we're doing what we're doing, to a tune of about a $1 million savings. So tonight I'm just proposing to you that we utilize Vizient, which is the same group that we're using for our emergency room revamp, in a tune of $312,000, $330. This will create the observation unit, provide the 24/7 support, similar to what our ER project is doing now. Mr. Ewing and I, for the ER project, we're actually getting hourly updates. Who's in our ER, who's waiting, how long they've been there, what the holdups are. So this is very engaging with the hospital leadership to get us where we want to go and save that $1 million at a minimum, savings moving forward.
Is, in ER right now, are we seeing a big change in the number of people not seen?
So we still have decreased census, but what we really are seeing an impact on is those people that are coming to the ER, we're getting them direct bedded. And what that is door straight to the bed and don't go to the waiting room. And we're averaging from the door to the bed 3 minutes. From the door to the time they go home was averaging around 170 to 180. Last week we averaged 130 with the first week of the project. So I think they're seeing a lot, which in turn, we hope starts bringing the volume back because there's not really a wait to come into the emergency.
Sure.
I have a couple questions.
Sure.
What, did you say a percentage on the coding errors?
Not on the coding areas, but 30% of our observation cases are discharged in an observation status,
Okay.
and the industry standard is about 21% of them. So we have some conversion improvements that we need.
And this is from the ER?
This is not related to the ER, this is the hospital
The
as a
hospital.
whole, so you're looking at your inpatient.
So the observation unit will cover the ER and the hospital as a total as far as discharges and?
So the ER runs separately. This is for those patients that need an overnight stay, whether it be for 23 hours or even longer. And so this will focus on the inpatient side of things, but it's still through the same company. So Vizient will have the leader, his name is Dr. Lipton, for the ER, and then now that they're kind of rolling, he's going to break, and if this is approved, he'll focus on us creating an observation unit. And in the observation unit, yes, it does run like the emergency room, because the goal is to get the patients what they need, the treatment they need, and out the door. So we'll work on protocols and policies with the same time frame and mindset that we would as an ER patient, but they'll be on the inpatient. Do you have anything you want to add?
No, I mean, she's covering it. I mean, you're just trying to move the patient either out of the hospital in an appropriate outpatient status or deem them an inpatient and get them into an inpatient bed quicker. And it's that 31% down to really where we should be, that 21%, that isn't getting converted into an inpatient status. So we're losing revenue on that, even though many times they're staying past the 48 hours. And when a patient stays past 48 hours, we don't get paid. I mean, we get paid up to 48 hours after that. There's no reimbursement. So the thought by Medicare is that those patients should be converted to an inpatient status and go that way. We're not able to get that cleanly done by creating an observation unit and dedicating it to that particular type of patient flow. We should be able to either get them discharged to outpatients or admitted to the floor with the proper designation.
Doesn't 21, I mean, with what you're doing, doesn't it seem like you could break that 21 in half? I mean, it seems like this could almost go away.
I do think that we will have some, but I think we could definitely get to the 21 or even below that. Family practice is really on board with us to take that observation unit and work with us and develop those things. And when you have that kind of a partnership, I think is where we can really make some moves.
I know you're not gonna let 21 be all of it.
It's not going to be, that will be like the starting number.
So it's not a coding issue, it's a physical movement of bodies issue.
It's not even the movement of a body, because I can stay in the same bed and be an observation patient, and I can stay there and be an inpatient. It's the way that we have it registered into the system. There's you're registered, if you come in with chest pain, you're more than likely gonna be registered as an observation patient until I figure out if there's another reason you need to be here that's causing the chest pain, or if I can fix the problem and send you home with follow-up appointments. But if I find that you need a stent or you need some major procedure, then I might change you to an inpatient where we would get a different type of treatment.
Well, this is something that I guess we discussed a while back. How are you gonna change, because I have been part of that process where I sat here for 3 days waiting for a doctor who went somewhere to release me. And I know that's not the same, but I know that if you're waiting for a doctor to come in and he comes in at 7 o'clock at night and not at 8 o'clock in the morning, therefore you have a, 13-hour lag, is that something that's being considered, or is that?
So that's the point of having an observation unit, not just a place to put the patients, but the physicians are there, they run it 24/7 like your emergency room runs, and they work under protocols, or nursing staff work under protocols, because they are hired and geared to the project to get these patients out. So it won't be like an inpatient where if you come in at 5 in the afternoon and I've gone home, you don't see a physician until 8 in the morning. They're gonna be here, and their job is to do the test and get you out of here.
Okay, so say I come in and I have Dr. Smith who sees me in the emergency room. Or I go to Dr. Smith to see me, and then he goes home. And then I see Dr. Jones, who is gonna observe me supposedly. So that means that Dr. Smith his ties with me will end right there. Dr. Jones will take over.
Yes, that's correct.
So Dr. Smith will no longer get paid while I'm in the hospital.
Right.
He
When
loses
you're in
me.
the
Okay.
observation unit, those physicians that are running the observation unit will be those caregivers, and similar to the hospitalist. So if there's a follow-up that you need to see with your physician and you're ready to go home, they're gonna give those reports and get you transitioned over to follow-up care.
So could the doctors in observation release you? Okay.
The goal is if you don't need to be here, we wanna get you home.
Have y'all talked to the doctors? in the
Yes,
ER?
all of our physicians, including, we've really mainly spoken to our emergency room, and of course, Dr. Benton and his team on the family practice side, find out what their buy-in is, and they all are aware that we have an observation problem.
Right.
It's just a matter of how are we gonna fix it.
How quickly do you think you could implement?
We said we wanted to have an observation in place by the first of the year. Dr. Lisende their team is just waiting on approval, so that we can work to a timeline.
So are we bringing in more doctors, or?
No, this is a team that she found when she was
Yeah,
looking at
this
the
is just a two-person team.
ER.
He's an ER physician / engineer, and so he works through flow, and we get a cheaper price just because we're part of TPD and Vizian is a partner.
It's the process.
Yeah.
But no new physicians, family practice team is here, the ER physician team is here, and they are all willing to partner to make this work. So we don't have to hire a physician.
Well, I think that's gonna work great.
Do we need to,
I'd entertain a motion.
I'll make a motion to approve.
I've got a motion and a second. All in favor, say aye.
Aye.
Opposed, the same. Motion carries. Thank you.
Thank you.
Consider approval of agreement with Health Grades. Allison Fraser. Hello, Ms. Allison.
How are y'all? Right. I have a proposal today for health grades. We currently have a call center. We have patients calling in for physician referrals, service referrals, event registrations, anything that we have going on. This is a new contract that will replace an existing contract that we currently have. After the initialization fees that we would have to pay one time, it would be about saving about $60,000 annually. This is not only a better service from what we've seen, but it is going to be a cheaper service from what we've seen. So now I have all the information. Questions about it.
So who are we going to from who? Who do we have
We're
now?
currently with Stericycle, and we are moving to health grades. This all came up, we were talking to Stericycle about looking at the finances, look at some cost reduction. They charge us $3 per minute per call. Health grades actually gives us a 525 calls within and a set number within, no matter how many minutes. We did learn that in February alone with Stericycle, we had 3,280 minutes at $3 a minute with them. So
Wow.
those bills fluctuate anywhere from about $14,000 to close to $30,000 per month. Health grades will be about 13,000
What kind of information are we getting?
from them.
Yeah, I mean, what are we asking?
So we are asked, when the patient calls in, we are collecting demographic information from them. If they are doing a physician referral, they do rotate through the database of both for this physician that has been referred. If it's a family med doctor, they will go to the one that's their turn. They do English and Spanish, and they do a warm transfer. So this is something that they will stay on the line, call the clinic, introduce the patient to that clinic. If for some reason that physician can't get them in that day or whenever they need to see them, they'll just move to the next one, and they will stay on the line until they can get that patient connected.
Oh, okay, I remember what we're talking about now. Okay.
Yes. So we have talked about this through patient experience and with Mr. Ewing, and this is something that looks really good on those sides of things as well.
Can we, Ben, maybe you could volunteer some time.
More time?
You'll expand it, yeah, they got.
Spanish?
Yes, for the Spanish time.
All right.
Glad you
Forward from our
volunteered,
vote.
since you got two full-time jobs. All right, I will
With that-
entertain a motion.
With that, I'll make a motion for approval.
Second.
I have a motion and a second. All in favor, say aye.
Aye.
Opposed, the same. Motion carries. Thank you. Okay, we're gonna go into executive session. Meeting held in closed session involving any of the following: consultation with attorney regarding legal matters and legal issues pursuant to section 551.071 of the Texas Government Code, 2 MCH-2045 advanced directives, advice, recommendations, opinions, and other material reflecting the policymaking process of the Ector County Hospital District as per section 552.111 of the Texas Government Code.
Mr. Chairman, 1 second. Attorney Steve, since we were at a public hearing, we opened that. Is there any language to close that public hearing that we need to put in the minutes? Are you okay with just a transition?
I was gonna tell them, thank you.
Oh, can we go now?
Thank y'all.
Thank you so much.
Thank you for coming in.
Thank you.
Appreciate
Thank
that.
you.
It's $3 a minute if you want to stay.
Oh, you know what? There is one other thing I need to read. A special meeting of the Ector County Hospital Board of Directors will be held in this boardroom on September 17th, 2020 at 3 p.m. to accept comments from the public on the proposed fiscal year 2021 operating capital budget and to vote on the proposed 2020 ad valorem tax rate. Sorry about that. Thank y'all.
Have a public hearing.
Executive session. That's it.